Good afternoon. I am Nikki Harris, Training and Education Lead for the Center of Excellence for Behavioral Health in Nursing Facilities, and it is my pleasure to oversee the delivery of mental health and substance use disorder training and education to nursing facilities nationally at no cost to the nursing facility. And now I will introduce our presenter, Ms. Diana Padilla. Today's presenter is Diana Padilla. Diana has more than 24 years of experience in the behavioral health industry. Her vast experience includes service provision to diverse communities with substance use, HIV, and hepatitis C, trauma, stress, and other psychosocial conditions. Currently, Diana is a senior staff trainer for the Northeast and Caribbean Addiction Technology Transfer Center. It is my pleasure to turn it over to Diana.
Thank you, Nikki, and thank you to the whole team for the support, and thanks everyone who is here today. Appreciate your time to talk about this really important issue that we seem to find very elusively within our settings. So our task today is to talk about the prevalence and challenges of substance use disorders and all related type of information as it applies within your setting. Some of the things we want to think about right now is how prevalent is substance use, particularly with some of the residents that are in our care. Many are the elderly, but it's not just the elder population. But what we do understand is that aging is associated with degeneration-related physical pain, which can provide exposure, as we know, to opioid analgesics, and those are our pain inhibitors or the pain relievers. And so when we consider that sometimes some of our patients or residents may have other risk factors within their life, and this can be very individual, so it can increase substance use. And so in increased substance use and substance use disorder, which I will speak to in a minute, it's especially a risk for folks who have complex trauma, perhaps they have medical conditions, perhaps they've been dealing with certain situations for a long period of time. They may or may not have some mental health problems, and even other risk factors that we have yet to learn about. It's really important to take some of that data that we gather when in admission and really consider how it can provide a situation where it may put that person at risk for substance use. We also know that alcohol and substance use disorder with the elderly population tends to go underreported or underdetected or undertreated. Many times that has to do with the perception of either clinical care or family and friends involved in that individual's life. And because sometimes we have a vision that someone who is involved with substance use may not necessarily be an elderly person, and elderly persons do have the opportunity to drink alcohol, to use more medications than they are instructed or directed to do or prescribed. And so we're going to talk a little bit about how that applies. There was a survey of 17,000 Medicare beneficiaries that found that 2 out of 5 patients reported taking 5 or more prescription medications. And so more than half of these folks were non-adherent to how they were supposed to take their prescriptions. And so when we think about those types of numbers, it gives us insight as to potentially what can happen with any one of the residents in our care. Substance use in nursing home residents also include alcohol and other substance use risks of increase with folks who are seeking long-term care. And we're going to talk about folks who are in your care for acute services. And so short-term residents recovering from an injury, there are times where you have folks who are in short-term care in your nursing home facility, and they may be folks who have already in recovery from their addiction, potentially their addiction, past addiction use, or a substance use disorder. And so the particular circumstances that they may be in, being in the setting, the medical complications, the fact that they're exposed to other medications for their care, for chronic pain and so on, can increase their care. All the more reason why nursing homes licensed nurses do tend to be the ones to actually look at all the different medications involved and to help monitor and manage their intake to minimize their the potential for recurrence or relapse. The misuse of prescription medication is especially prevalent. But what we also know is that alcohol and illicit substances can be an issue too. And when we think about that, we also got to think about if you consider the elderly population, and when we think about alcohol when it's problematic, many people in society think that problematic alcohol consumption has a certain picture, has certain behaviors with it, you know, the slurring of the speech or stumbling over. Doesn't necessarily have to be such observable symptoms of alcohol consumptions. With the elderly, there's not much alcohol that needs to be ingested in order for it to provide an impact. And so it can be pretty elusive. And that's why we're speaking about this topic here. So generally occurs when residents go on leave of absence, and whether it's an approved leave to outside of the facility or it's an elopement, we really have to be attuned to what potential behaviors or what potential substance use they may have been engaged with, and understand how that might be a reason to screening, to have a conversation, and to understand the implications, not just for their health, safety, and their wellness, but also for the safety of the other nursing home residents in your care. So it's really interesting here to make a distinction. Just want to make sure many times for folks who are not necessarily as informed, and many of you are, but many people in general tend to think about substance use either from a binary perspective, whereas an individual is not necessarily engaging or indulging in substances, or maybe taking medications as prescribed, or they may be at the other end of the spectrum where they have a problem, they may benefit from treatment services. And so, but there is a lot of in between that the research has been showing the last many years. So substance use terms and levels of use can vary. And so substance use itself, when we think about the terms, this can help reinforce within our minds, you know, some of the things that we know are kind of remind of some of the things that we've learned over time. So substance use is really specific to just the consumption of psychoactive substances. So but it can include tobacco, illicit substances, or prescription medications. Misuse, substance misuse, is really speaking to, say, for example, using medications other than how it was prescribed, other than directed. And so it's also indulging in illicit substances and starting to experiment. Misuse can be doing it not just to experiment. And so there's also another term that you should be familiar with, and I really encourage you to be mindful of this, because we're seeing more and more of this research and some more and more of this reference in the literature. And so at-risk substance use, often referring to consuming alcohol at levels that can cause harm or can cause consequences for the individual, but not necessarily to the point that the person can meet the criteria of substance use disorder. But it could still be at a point where it's impacting their wellness, it's impacting other potential medications that they may be using. It could certainly impact your care for them in terms of how effective and their health outcomes with the care that you're providing them. And so this has to do with, you know, exacerbating mental health issues, health-related problems. And so at-risk substance use can often be a way of kind of coping with challenges in a person's life, whether it's someone in acute care in your setting or someone in long-term care. And so from different levels of these terms and different levels of consumption, we want to consider that not everyone is just using substances or experimenting or going to the other end of the spectrum and having a substance use disorder. Substance use disorder is what we tend to look at a lot in. I know the state operational manual for nursing home facilities tend to refer a lot to substance use disorder. I kind of just want to encourage you to also be mindful that there's other levels as well. Substance use disorder is a cluster of cognitive, behavior, and physiological symptoms. It does indicate, has a certain part of the criterion for diagnosis includes the continued use of substances despite the consequences. And so to look at that a little bit more specifically, we kind of say, if we take a step back and we think about why do people take drugs? Now you have patients, you have residents that you've been working with for some time, and you know that everyone has their own individual challenges. And so we do know that some folks are just using and engage or consume substances to feel better, to have sensation, to take a break from work. It's a hard day, you know, it's been a hard week, maybe had to do a lot of overtime. Sometimes folks will want to kind of just come down and debrief just off their week, not just off their day, and some substance, whether it's alcohol, whether it is smoking marijuana, because it's legalized in a lot of different areas. That can be a way of why somebody wants to experience or, you know, taking substances. Other reasons can be to feel better. And a lot of you folks are very familiar. You see this all the time with your nursing home residents. There's anxiety, there's a lot of challenges about maybe mortality. There may be depression involved, fears about what medications or what procedures or how long they have to stay, or when they're not seeing family or friends. And so you start to see this from a lot of different perspectives. You folks are more familiar with this than anyone. So one of the things I did want to provide you here, when substances are being indulged in, when someone is using substances, what happens to the brain? And this is a short video that I'd like you to kind of consider here.
Scientists first began to understand addiction as a brain disorder in the 1950s. Doctors Olds and Milner, in laboratory studies of rats, found the parts of the brain affected by addiction. But then in 1994, Doctors Volkov and Shelbert, top neuroscientists, ran CAT scans of the brain that showed the effects of substance use disorders. Like other diseases, these scans showed it affected tissue function. There are two main parts of the brain affected by drug use: the limbic system and the cortex. The limbic system, located deep within the brain, is responsible for our basic survival instincts. So when you do essential things to stay alive, like eat, drink, find shelter, have sex, or care for your young, your brain reinforces behaviors that cause the release of dopamine from this region. That reward for surviving is also transmitted to the amygdala and hippocampus, which records a memory of that feeling, so we seek it again. This is our survival hardwiring. Addiction also affects this area up here in the prefrontal cortex, which is what separates us from other animals. This is where decision-making and impulse control live. When drugs or alcohol are used, they activate the same dopamine process in the survival center. And when use is repeated, that substance can hijack that part of the brain. This hijacker changes the brain and weakens this system to make it believe that the primary need for survival is the drug. In hijacking the brain, it can usurp those primary motivations: food, water, shelter, sex, and protecting our young. And the hijacker needs more and more of the substance to activate the same level of reward or feeling of pleasure, causing the brain tissue to become increasingly damaged with continued drug use. There are factors that put you at higher risk for the hijacker, including individual factors like genes and age of first use, and then environmental factors like drug availability. But if the hijacker takes hold, addiction is treatable. Advancements have been made in assessments, detox, treatment programs, recovery supports, and medications to treat addiction. Brain scans show that once in recovery, the tissue in the limbic system and cortex can get better. With your help, we can expand these innovations to help millions of individuals and families and ensure that addiction is treated as the medical issue that it is. Together, we can solve this. Join us.
So that's a quick video that I am very fond of because it really does explain how substances and how neurological systems in the mind or in the brain pretty much not just gets hijacked. It's just the reality is that for many people, they don't necessarily have the capacity to stop using substances. They don't necessarily have the capacity to see the consequences of their use. And a lot of what was spoken to in the video actually speaks to the criteria for diagnosis for substance use disorder. And so for folks impaired control, unable to stop substantial time using substances or how that chronically can progress, all of these, you got social impairment, you got risky use, and for opioids and alcohol, you also have, the tolerance and withdrawal features of substance use disorders or alcohol use disorders or opioid use disorders. And so it's very specific within the DSM-5, the Diagnostic Statistical Mental Health Manual of Mental Health Disorders. And sometimes we see some of this behavior. It seems observable the way we can see it. And there are times where it can be very elusive because someone may not meet the criteria. But the whole point of the video and this is to kind of bring up the issue of the lack of capacity with some folks in terms of how we engage them and how we can help support them in a potential recovery and wellness process. So the continuum of substance use, this is the binary perspective I was referring to before. Many times society in general who are not as informed about addiction and its potential impact on a given person can see that someone can consider that someone is either not using or can handle a drink, or they may be considered that they have a problem and they can benefit from care. But there's a lot of gray colored areas in between where someone else may fall, where they may be consuming, where you may not necessarily instantly can tell that someone's level of consumption or that they got consuming in a way that it might impact their care, that might impact their medication process, so from that perspective, there's substance use disorder within the DSM-5. There's one for, the way the manual has it labeled is for opioids, for tobacco. There are several types of use disorders. And understanding that perspective from the criteria and how they're diagnosed can be very helpful in what you might see. And so some of the long-term effects of substance use include withdrawal happens with alcohol consumption, and sometimes we don't necessarily think that the elderly might have that issue, or someone who's already in recovery who may be exposed to alcohol consumption within family and friends when they have an approved leave. So these types of things are things that we want to be considerate of. Heightened stress response, the physical changes to the brain regions, the video had just showed, so if the limbic system was being impacted by the substance, and then the prefrontal cortex is not functioning as well. Those functions tend to be compromised. So you see judgment, decision-making, memory, behavior control all being compromised. And not necessarily is a willful thing, but it's more because the capacity is limited because of the substance use. So some of the signs you want to look for is those frequent leaves of absences with or without facility knowledge of really red flags. You want to be able to look at that and understand why they're doing that. And so those are potential red flags for you to follow up with. Unusual unusual odors or neglected appearance, red eyes. These are things that commonly may be seen, but are not common to the individual as you know them. And so if they're disheveled appearance or they tend to have red eyes, and that's not their norm, then you would be the one to be able to recognize that. There may be needle marks or new needle marks. Sometimes there's bruising around needle marks. That bruising would be a really good telltale sign of an individual that you've been caring for. If you haven't seen that before, that might be indicative of a potential issue to explore. And so you have some other things like drowsiness and slurred speech, lack of motor skills. So mood changes can also accompany substance use. Particularly watch for when they are about to go out or just before they have an approved leave from the facility, or when visitors or friends come to visit. Those are good times to kind of be aware of what to look for. And some of the things that you can do, if you see that there is some issues, there's some miscoordination with their having to, their motor skills and having to move, just help them safely to their room. It's really important to not take a directive approach in a very harsh tone. Speak very calmly to the residents so they can feel that you're approachable and they're more receptive or more likely to be able to respond and share with you that what they may have indulged in or consumed. Certainly notify the physician right away about potential contraindications from other medications that are being taken, and allow the physicians to guide the team as to how to address the potential issues with with the nursing home resident. Notify resident representative that all behavior, if that certain types of behaviors that continue, outings and visitation could be limited, because it poses a threat not just to the individual and not just to the resident, but to the other residents of, at the facility as well. And you want to be able to educate family and residents that the behavior is against nursing home guidelines. It's a good time to reiterate that. And it's potential for discharge, but there's more to it than that. You want to be able to have a team perspective to do this. If patient becomes disruptive or violent, only the police are the appropriate resources to access. If you're concerned that someone has on their person, or they have it somewhere, they have some substance or alcohol somewhere on their person or in their belongings, since you're not able to legally actually, search someone's someone's things, you may want to access local law enforcement to help you with that. Educate associates to closely monitor patients or any significant change, report anything you see to supervisors and colleagues, and update their care plan accordingly. The impact of substance use also includes physical health issues. Sometimes these can be very elusive because these represent also, some of the behavior issues that can happen within the medical conditions that they have. But alcohol-induced dementia, which can happen for, particularly, I'm going to say this specifically with the elderly, because the elderly don't need as much alcohol to actually feel an impact. Alcohol, more than one drink in a day for any person 65 or over is considered not healthy. And so alcohol-induced dementia is something to screen for. Cirrhosis of the liver is a potential outcomes of consumption, and including intestinal bleeding and stomach problems. And so sometimes when there's gastric issues, it may be related to opioids or alcohol consumption. So thinking about, what changes may be happening with their interactions with family and friends, changes in their behavior, other financial issues. And so some of the things going forward, just to take advantage of the last couple of minutes that I have with you, what can you do? Well, some of the things is to think about, the language that we use. We try to use affirming language when we're engaging with nursing home residents, because we want to build their receptivity to how we can support them. So affirming language, as opposed to labeling or judgmental language, will be more conducive to be able to help them in their wellness process. So affirming language to promote their recovery and ensure that you are there to support them. And so facility, facility staff never know who is at risk unless they ask. I talk about screening all the time, the importance of that. It's not always just at the beginning of admission. There are different times along their care continuum that you may want to consider, screening, especially if you think you see a potential sign of substance use. Help identify residents in need of specialized care, provide opportunity for education, early intervention, referral to treatment, alert the physician to the risk of interaction with medications as previously stated, and provide beneficial and proven beneficial in reducing high-risk behavior of people who do not meet the substance use disorder criteria. So there's a lot of other people that potentially you can also support and help. And so patient-centered care here is really important. And the care plan really has to include any potential substance use impact and how it can, what implications it may have for their health conditions and the reason why they're in your setting in the first place. And so think about coordinating care services and utilizing the care plan, where where you can partner perhaps with behavioral resources in your community and be able to better maybe update and maybe more tailor their care plan to include supports for their substance use. So last thing I want to say to you is, tips for nursing home staff to support residents with substance use disorders. Ensure staff at all levels in a nursing facility can recognize the signs and symptoms of substance use. This is not something that you're necessarily aware of a lot of times. So it's good to have a refresher every once in a while because of the elusiveness of substance use and what it can look like in different people. And it's not always the end of the spectrum with a substance use disorder, but you can certainly have an opportunity to intervene, which would be great. So if you think someone needs help with substance use, notify the Director of Nursing and Administration and for further evaluation and care planning. Recognize that people with substance use disorders or at-risk substance use have medical conditions, including mental health disorders, and again, further evaluation and care planning is essential. Everyone can play a role and to helping residents. So you have the clinical nurses, you have the physical therapists, you have administrators, you have the primary physician, you have different individuals that as a team you can collectively really enhance a wellness process for any given nursing home resident that might be at risk for substance use. So going forward, facilitate screening for substance use, identify level of use as part of their admission process. I do a lot of work around screening, brief intervention, referral treatment, and that is an evidence-based process that you can do in a matter of minutes, 15, 20 minutes. It's a matter of screening and then having that conversation, very, very specifically tailored to their the behavioral issues, and then a potential referral for further supports. And then you have the order, which is also alcohol screening, and many times you have it at the beginning of admissions, but it's not a bad idea that when you see these red flags to actually facilitate a screen. And so sometimes you can use that one question only. So engage residents, provide substance use prevention and treatment supports, train the team on what the potential approaches and strategies that you could use, and strengthen the efforts to educate residents. They're in your facility. It's not a bad idea to give them opportunities to educate them on medication, prescription adherence, and other potential issues that they may be going through. So encourage them to be active partners in their own healthcare process, and that actually kind of leads to commitment to their wellness. So we have a question. So would you like to read it out loud? Let me just go to the next slide.
Okay. We have the question, are there any standardized screening tools for SA disorder, substance use disorders, recognized by agency use, MAST, DAST, or ASAM, etc.?
Oh, for sure. So there are many. So the audit is specifically for alcohol screening, but you also have the CAGE aid, which actually asks 4 questions that are not very specific to, say, quantity or frequency, but talks about the impact. And so that might be more conducive to residents who may not have a good memory about, consumption, how much they indulge in. So you have the CAGE aid, the MAST, the DAST, the Assist Light is being used with the elderly. And so it's been recommended more often with that community. So there are a list of different ones that we can provide you on. We can provide you all those resources. What I encourage everyone to do is that when you do a screening and there's a potential for substance use, follow it up with a brief intervention, and that's just simply a brief conversation about how to reduce consumption. There's a lot of folks that may not meet the criteria of substance use disorder, but there's a lot of people that would benefit from your care, from your informed substance use informed care.
All right. Thank you so much, Diana, for serving as our presenter today. This information is so valuable, and we greatly appreciate you for partnering with the center. And we thank each of you for attending today's training.